Welcome to Garden of Fertility. I am Opera Stella Talma, your fertility counselor. I am a medical lab scientist by profession. Today, we are going to be talking about why do some pregnant women die before and after childbirth and how to avoid it. But before I proceed, I would like you to subscribe to my channel. Turn on your notification button so that you'll be notified anytime I upload a new video. To my regular viewers, I say thank you for being part of this family. For majority of healthy pregnant women, childbirth is not dangerous or even possible serious event. In many cases, a difficult birth can be prevented from emergency with the help of a capable midwife or delivery assistant. It is a devastating tragedy for the family that is left behind. Many of these deaths are avoidable, and majority occurs in underdeveloped regions. But what exactly are the main cause of this unfortunate occurrence? We need to know why some mothers don't make it through pregnancy and postpartum period. Number one is excessive bleeding after giving birth. Uncontrolled bleeding from the uterus, cervix, or vaginal wall after giving birth is refers to postpartum bleeding. This is possible if the vagina or cervix are scarred in the previous pregnancy, or the uterus does not contract normally after delivery. As a result, it is very crucial that the pregnant woman seek the care of trained medical professionals, as this is one of the causes of unattended maternal mortality. It is possible that your life could be in danger if you give birth in less than sterile environment. Number two, infection. Sadly, some women develop some infections in the uterus or the reproductive organs after giving birth. If this infection is left untreated, it is called postpartum infection and it can lead to fetal death. Symptoms of this infection are most commonly bacterial, includes high body temperature, increased pains, and a discharge with unpleasant odor. After giving birth, a woman should always be checked out by a doctor if she experiences any strange symptoms. Number three, hypertension. That is high blood pressure. It is also known as preeclampsia. Some women may die after giving birth because of this preeclampsia. Women should monitor their blood pressure during pregnancy and after giving birth. If the blood pressure is high, they should consult their doctor for better treatment options. Poor control of blood pressure during pregnancy is a leading cause of hypertensive complications. Number four, obstructed labor. Obstructed labor is a labor in which the baby does not make a normal exit from the mother's body into the pelvis. The most common cause of obstructive labor is the baby head being too large or angled in a way that prevents it from passing through the cervix and delivery canal. Number five, blood clotting. Clots from wide varieties of veins throughout the body, including the veins in the arms, legs, and lungs. Complication arises because they can harm the lungs and spread from the heart to the brain. Number six, unsafe abortion. Mishandling of surgical procedures account to 13% of maternal death worldwide. Abortion is risky and is legal in some countries. So, how can we prevent this maternal death? What are the possible modalities to avoid it? Number one is education As what we are doing today, we are educating people on fertility education to increase their knowledge in reproductive health, birth control, and some other danger of unprotected sexual intercourse. This can help young women as well as men to make informed decisions. Unwanted pregnancy or risk abortion can be avoided with the right family planning information. Number 2, access to health care. Medical advancement, better management of existing conditions, and adoption of safer procedures have made it possible to reduce the rate of maternal death. Girls and women especially benefit from these services that promotes good nutrition and good reproductive health. Number 3, cleanliness. The best way to avoid getting sick is to take care of your personal hygiene and health routine. Regular hand washing, a clean perineal area during prenatal visits, and a sanitary delivery room can help to prevent the spread of infection. Number 4, prenatal care. Expert care before and after labor is essential for a healthy birth. Women ought to have their baby in the hospital, if possible. Home birth should only be attended by a trained professional. If giving birth in the hospital is not possible. Number 5, postpartum checkup. The outcome of difficult delivery may depend on a check for abnormal bleeding or infections. If a woman has a trouble of getting a postpartum care and can't afford antibiotics, she may be unable to take care of herself after giving birth. So, if you imply these 5 cautions being mentioned above, it will help you to prevent maternal mortality before and after birth. If you find this section informative, don't forget to subscribe, like, share, and comment on this video. You may be a source of help to somebody outside there. Thank you for watching.